Hey, it's your girl, your social work babe, back again with another episode of Mind Matters Understanding the Roots of Mental Health. Today, we're going to talk about the physical environment and ecological conditions, how they shape health and the well being of individuals, families, communities, and all that such. Because, we getting back to our mental health and what makes us the best you. In order to look good on the outside, remember you got to feel good on the inside. We're going to explore environmental justice and the growing role of the eco-social work in addressing health disparities linked to where people live, work, and raise their families. Me, I'm a small town girl from Huntsville, Alabama, but I currently live with my husband and three loving boys in Las Vegas. Not a fan. Get me back to the South. But either way, we're here now, and what I've noticed is residential areas we you suffer from extreme heat. There's nothing green here. It don't rain, it don't snow. Ugh. And don't let California get a wildfire. We get hit with the smoke. Seriously, it be smoke clouds. Last summer that there's been a couple fairly large, I'm gonna say pretty big wildfires in California, and the smoke can get so bad that the kids don't go to school. It's terrible. It smells like fresh burning wood, and being from Alabama, when it's controlled, I love that smell. That I'm not a fan of, but either way, no green. And it's a lot of fast food, liquor stores, convenience shops. You can't get no fresh food. They have farmers markets, but they're really just swap meets of people trying to sell their homemade stuff. Not a fan. And what you can get at the grocery store as far as fruits and stuff, it's so high. You know it's all imported because again, it's the desert. They can't grow nothing here. Now, the influence this physical environment, ecological conditions has on the health is big. Extreme heat means dehydration, cardiovascular strains, sleep disruption, and mental health distress, especially for kids. I know my son, my 8-year-old, his acid reflux has been acting up really bad since we lived here. So, we definitely have to monitor his water intake, make sure he's not getting overheated outside. And that makes him depressed because he wants to go outside and play. He's anxious about getting too hot. All these things play a factor into your mental health. Air quality, as I stated, terrible, especially if it's a fire somewhere else. We still get hit with it. That is shocking to hear, but yes. And this can definitely take a hit on your mental stress. You can be emotional distress. It's definitely a financial strain if you don't have insurance and you're having to buy CPAP machines, acid reflux medicine, asthma, all these things. It can take over your quality of life. Strategies, social workers to address these environmental challenges. You can definitely get involved in your community. Also, you can immediately get them to letting them know what's in their area that can help them, whether that be, Catholic churches that can help with the price of medicine, giving them ways that they can still be active but not getting overheated outside, like community health centers. Education and empowerment are essential, helping clients understand how environmental factors affect their health to reduce self blame and encourage proactive coping strategies. Housing quality, neighborhood safety, again, access to resources is a big product, and just being, overall informed of what you can do to help those around you. Environmental justice refers to the principle that no group should bear a disproportionate share of environmental harm due to race, income, social status, and in many urban communities, low-income neighborhoods are more likely to experience pollution, inadequate housing, limited green space, and climate-related risks. Eco-social work expands traditional social work by recognizing how these things are intertwined, whether it be human health, social systems, and natural environment. This perspective emphasizes that environmental degradation is also a social justice issue. For communities like mine, environmental injustice may show up as high exposure to heat, fewer health promoting resources, and limited political influence. Social workers have an ethical responsibility to challenge these inequities and advocate for healthier environments. Social workers can advocate in several meaningful ways at the micro level. This includes helping clients access emergency utility assistance, medical care, and safe housing. At the meso level, social workers can support community organizing efforts focused on neighborhood safety, food access, and environmental improvements. At the macro level, advocacy may involve supporting policies that address climate resilience, affordable housing, environmental protections, and urban planning that prioritizes health equity. Educating policymakers and the public about the link between environment and health is a powerful tool for systematic change. Why this matters for social work practice, understanding environmental ecological influences strengthens social work practice by promoting a holistic biophysical biosocial perspective. When social workers consider physical environments alongside psychological and social factors, interventions become more effective, ethical, and sustainable. This knowledge also aligns with core social work values of social justice, dignity, and worth of the person in service. By addressing environmental injustice, social workers help create conditions that allow individuals and communities to thrive, not just survive. Again, all in all, be aware of what's going on around you. All of this and everything is connected. Everything affects your mental health. If you are stressed about medicine, if you are stressed about, if I know for me, my son, and watching him, I get stressed. He wants to go inside and play, but he has to remember I can't get too hot because I'm going to throw up. And if he plays too hard one day, because of his acid reflux, he feels it the next day. And he's aware of that, and that stresses him. Think about it. If you live in the South and you live somewhere humid, you know what we say. Gotta go out at 5, 6 a.m. because it's gonna get too hot. That is a mental toll. You don't want to deal with the heat. That affects you. Having to plan your day around peak heat, it affects you. Having to plan your day around if you're living in a low income environment, having to plan your day around anything, it affects you. All of these things are connected. We are all connected. So remember, learn your triggers, know what's affecting you, be proactive about it, know what resources are there for you, and let's just all work better. Social work based signing out.